Hi, everyone. Welcome to the Pediatric Telehealth Coffee Hour. Today, I will be chatting with Catherine Valdez, a regional sales manager with Invitae, all the way from LA, and Molly Stetler, a clinical science liaison with Invitae from Kansas. And they're going to inform us about how our patients and families can benefit from genetic screenings, removing barriers to getting screened, and why screening is so important. A lot of families we work with have already been genetically screened due to their child's level of involvement, and some have not. Many families may not understand how genetic screening can help them with expectations and how to plan for potential care if needed. Some families feel their child's healthcare providers will set boundaries on their child due to a diagnosis. It's our job to help educate these families that we know that each child has different abilities and we will treat them based on our clinical and professional judgment. My therapy goals will not change because a child receives a specific diagnosis, because those goals are tailored to that child regardless of diagnosis. I was offered a genetic test when I was pregnant, but I didn't understand what my doctor was offering me at the time. I declined and I said, I don't need it because no matter what it says, I'd keep my baby. And this is true, but I didn't realize this test would have also helped me plan what my child may need if I had a child with special needs. Now that I have had a genetic screening and found out that I'm a carrier of Smith-Lemel-Oppitz syndrome, I hope I said that right. I realize how important it is for families to know their options for genetic screenings. And we are in these families, we're within our patients' homes and talking with them. And some of us treat women for women's health issues and adults also. So having this knowledge about genetic screening and what's available may help you answer some questions your families and patients may have. I also am posting this interview on my personal Facebook page and my business page because there may be some information that's good just for individuals that are curious about genetic screenings. So sorry, ladies, if I got on my soapbox. Catherine has been educating me on the importance of genetic screening, and she's made me very passionate about it. So let's start off by telling us about Invitae and its purpose.
Yeah, thank you, Marlene. I'm super happy to be here with you and to have a chance to talk to some members out in the virtual world. I'll tell you a little bit about Invitae. I love that Invitae has a mission, which is to remove barriers to all genetic testing. And we want to be able to screen as many people as possible to empower them to be able to act on the genetic information that we uncover. So Invitae does all kinds of genetic testing, everywhere from newborn screening to maybe increased cancer monitoring. So once someone already has been diagnosed with cancer, we can look at recurrent cases using blood or saliva. We have multiple tests, and I'm just really passionate about trying to make sure that everyone understands what's available to them. And Invitae has always been a very big fan of removing any barriers to getting these types of tests. And barriers, I mean, maybe cost or having the provider available to order a test for them. We make it very affordable for everyone. So we'll talk a little bit more about that today too.
And what's the difference between a screening and a diagnostic test?
Molly, I'll let you take that.
Happy to address this question. So in the field of genetics, we recognize that there's a level of variation in everyone's genomic background or their DNA. And so there's different levels of genetic test that may be directed to confirming a suspected clinical diagnosis in a child or an adult who's manifesting with symptoms. The provider recognizes that there's a collection of features suggestive of a genetic condition, and they want to order diagnostic testing to confirm the presence or absence of disease or an increased risk for disease. And then there's other opportunities that aren't limited to DNA testing, but there's other ways to screen for different, chemicals in your blood. Or Kat mentioned newborn screening, which is a public service to all children who are born in the US to just screen for different findings, variants that may or may not be indicative of a disease, but may mean that if I'm a woman of reproductive age and I elect to pursue a carrier screening test, it could inform my health risks for having a child with complex medical needs. So it's not diagnosing a health condition in me. That's not the goal. It's to do a genetic screen of some of my DNA and my background genetics to then inform what the risks could be if my partner and I were both carriers of the same disease. Then we could talk to our provider about the goals of what we want for the future for our child and having an early diagnosis to improve outcomes for our child.
Okay, so then like if the child got a genetic screening and it came up that they were affected by it or could be affected by it, potentially then they could do a diagnostic test to confirm if it was correct or not?
Essentially, yes. So, for instance, in the neuromuscular space, a child may be picked up by his or her physical therapist, and they might recognize that they have low muscle tone. They have a pattern of weakness that you've observed maybe in a different child or a patient of yours who you know has a genetic condition. They may be encouraged to get a referral to an experienced neuromuscular specialist who then does an evaluation, a physical exam. They may run some baseline screening tests. And then if that comes back suggestive of a genetic condition, they could run a confirmatory DNA test that could confirm the diagnosis, or maybe it'll identify a similar diagnosis that could have implications for the family, for that patient, and making sure they're on the right treatment plan based on that diagnosis.
Good. And how many types of genetic screenings does Invitae have, and which one is most appropriate for a family considering having another baby or a first-time baby, or if they're already pregnant?
Well, we do several tests. So, for example, we mentioned the newborn test. We also have PGX testing, which is where we might be able to look at medications and a patient's potential response to these medications. And we do cancer testing. We have cardiovascular testing. We have tons of medical grade tests that can inform on patient situations and on ongoing medical management. So the kind of question or the testing that you're looking for in this case would be carrier testing. So when the ideal situation would be to order this test prior to ever becoming pregnant, because then you get to have the most options. You get to have conversations with your partner and with your family and with your physician about options, just to understand what your risk might be of having a child born with one of these conditions. So that particular screen, it's called a carrier screen, has multiple genes on a panel. A panel is a list of genes that we're going to be screening this particular patient for. And that would be ideal to have, again, prior to getting pregnant, but it's typically ordered when a patient is already pregnant and we want to kind of understand what types of risk she might be at risk for. So on the carrier screen, we screen, I'll get a little bit geeky with you for a minute, we screen autosomal recessive conditions. And what that means is, and X-linked conditions. So basically what that means is if mom is a carrier of one of these recessive conditions, we would then screen the partner. And if he is also a carrier, we understand that there may be a 25% chance of having a child affected with this condition, a 25% chance of having a child who is a healthy carrier, meaning you, patient, were also a healthy carrier because you didn't even know you were a carrier of this particular gene and you're unaffected, and a 50% chance that the child would just be born without being a carrier of this condition or being affected of it as well. And then the X-linked conditions means that if mom is a carrier and mom alone, there's a 50% chance that she would have a boy affected with this particular condition. So we're looking at those genes on this particular carrier panel when someone chooses to ask their doctor to order this type of testing.
And then I think when we've talked in the past, you said typically if a woman's pregnant, a doctor, like for me, I'm pretty sure I remember my gynecologist offering me these tests and I just didn't really understand it. So typically when a woman's pregnant, they'll be offered this. Is that correct?
Yeah, that's right. They should be offered this. And I think it's really important to have patients understand their options as well. Otherwise, they're just kind of limited to maybe what is going to be offered to them at that point, right? So ideally, they would go in, and if they're pregnant, the doctor would say, would you like to have this type of carrier test? It's going to look at your genes. The way I ask my doctors to explain it is maybe say it's kind of like taking an X-ray of your DNA, of your genes. And if anything jumps out as suspicious, then we're going to test your partner, and then we'll go from there. Now, the questions that these parents might want to ask or want to ensure is what types of conditions are we looking at? Again, Invitae is a medical grade genetic test, which means a provider has to order this type of testing. That's not to be confused with maybe like a fun test that might have some information about carrier status sprinkled in, and might have some information about cancer, and it might also tell you might have brown eyes, and kind of a more entertaining test than a diagnostic or a clinical test. This screen would be able to give you some real information that you're able to use. The physician would typically, especially in the women's health area, they're going to be more educated about these types of tests, and they will probably be using a lab that is a medical grade test. So the patient might want to ask how many conditions or how many genes are on that panel. And another big thing that Molly can talk to is detection rates. That's really big. Whenever you're ordering a test, just because a name is on the test itself, say, for example, any condition, you were a carrier of Smith-Lemli obits. If that gene gene is listed on a panel, you really want to understand the science behind it. Are they just looking at specific mutations? Or are they fully sequencing a gene? Are they doing deletion and duplication analysis? That's kind of a technical term for basically saying how thorough is the lab that you're using in looking at this particular gene. And then how many genes are on a panel. Some patients might want less, just because, like you said, they might not understand what they're looking at or what the outcome could be. But I'll give an example of a condition called Wilson disease. If a patient is affected with this particular condition, it's a common intellectual disability gene, and I'm not going to go into the depths of this particular condition, but I do know that if a baby is exposed to copper, kind of like in tap water, there could be some harm done just because of this particular carrier status. But if you knew that ahead of time, you'd be able to have a completely healthy baby. And there's things that you could do about this and just avoid tap water throughout the baby's lifespan, and they would grow up to be a normal, healthy adult. That's just one example of a ton of different things where it's clinically actionable. There's things that you could do about it if you know your status.
And I know that you talked about how the physician needs to write a referral, but you all do have some screens where if they don't need a physician's referral, right? Where they could just be like a cash pay type of thing.
Yeah, we do have some cash pay options even when a provider orders. You do need a provider to order this type of test always. But we do have a third-party service. It's called Genome Medical. And I would refer everyone to our website, invitae.com, invitae.com. And if you have any questions like that, just type it in the search engine and everything's going to come up for you. But Genome Medical is a third-party company that we use to give access to this type of testing. So it's still a provider that's ordering it for you. It's just maybe if a patient might live in a rural area and they don't have a practitioner that orders this type of testing or is comfortable with this type of testing, we have a solution for them to find something on our website using a third-party company. But so there's a way around it. There's also self-pay options, even if you have your own doctor ordering this and maybe a patient has a high deductible that they have not met yet. We have solutions for all of them in terms of billing.
Okay, got it. And I think that's also what I read on the website, where they would go through that third party to get a referral for it. So that makes sense.
Right, to be able to access it. Mm-hmm.
Right. And I know we talked about detection rate. So does each gene have a different detection rate, or when a detection rate is listed on a panel, is that taking like an average of all the genes that are on the panel? Like, how do you present the detection rate?
It's actually based by gene. Each individual gene has its own detection rate. I'll let Molly talk a little bit about how we look at that.
Yeah, so over the years, I think just to kind of give you some historical reference, how the extent of carrier screening, how different laboratories are able to do carrier screening has really evolved. And we recognize that different ethnic backgrounds have different risks for certain conditions. Some might be more common in certain populations than others. And just based on who we've tested over the years, we have some impression of, is our extent of genetic sequencing going to capture all of the potential disease-associated variants? Or do we know that even with this screening, it is just a screening test, so it's not a perfect test. There's limitations with it. And so if you are screen negative for a certain genetic condition, we would share a residual risk. So there is a level of background risk that remains, because it's not, nothing in the world is really perfect per se, but we're getting better and better. And as we do more testing of more individuals, as we grow the number of genes, we're capturing more of these potentially important genes and variants to know about for your health. So it's a pretty nuanced principle. It's connected with how common the condition is, how many genes are actually associated with the condition. Is everyone with Duchenne muscular dystrophy, there's only one gene associated with that condition, whereas limb-girdle muscular dystrophy, there's a spectrum of genes. So we're still learning about new genes. So just that you had even a genetic test, there's always a possibility we'll learn something more in the future as we get better and better and more sophisticated with our genetic testing.
And then kind of like going back when Catherine had mentioned how you'd want to ask your doctor how many genes would you be testing for on this panel. And I think y'all were mentioning how conditions have different genes. Can you talk about how earlier Kat and I had talked, and she had mentioned how some conditions can have and I may be saying it wrong, some conditions maybe have I guess if it's 87 genes and only testing for 3 conditions or something, that it could can you kind of talk about that? Like what?
Yeah. So, how many genes to put on a panel, different laboratories take in a variety of factors into consideration. There are professional societies that make recommendations. So the American College of Obstetricians and Gynecologists, ACOG, is an important group of experts we were listening to, and they update the guidelines. We also have an American College of Medical Genetics, and those teams of experts will make recommendations to maybe just do a core screen of the most common conditions. And again, over time, as awareness is increasing, how interest is increasing, we're also seeing that individuals really want more information, so they could pursue the option of more comprehensive carrier screening. So the comprehensive carrier screen may look really overwhelming. There's so many genes, but a dozen of those genes may actually be implicated with the same presentation of disease, the same diagnosis. It's just that there's different genes that could contribute. So it's important that you look at all of those genes to be most comprehensive in how you do the carrier screen.
Got it. And then I think we let's see, I have my list of questions here. So I'm
I'll just say,
got off
Marlene.
track. Yes.
I'll say, kind of talking to what Molly was discussing about how science just always improves over time. We learn more, we find out more. The more patients we test, the better the tests get across all labs. It's important to mention that if a mom has maybe had a baby 5 years ago or 10 years ago, you might wonder, should I do carrier screening again? And, just take into consideration that science changes, panel size changes. There may be new information that we find today that we might not have found 5 or 10 years ago. So I just want to mention that, you want to kind of keep that in mind when thinking about ordering carrier screening.
Right. And then I also know we talked about pediatric cancer patients. So can you tell me how a genetic screening would benefit a pediatric cancer patient, and at what age can a screening for this be done?
I'll tell you, I personally don't work with PDs, but I do work with oncology, and I
Okay.
can tell you that typically, if a child has cancer, is currently affected with cancer, it, you might find that a doctor would order a genetic screen based on on that type of cancer. So, for example, um, we'll just use colon cancer as an example. It's not a common one in children, but if you're looking at genes associated with Lynch syndrome or colon cancer, that's probably what they might order on a child at that point. And it could inform on therapy. There could be targeted therapies or immunotherapies that are specific to that type of mutation. And it's called a germline mutation, by the way. This is what the type of testing that we're doing, which is what you're born with. Then there's also somatic mutations, which Invitae can do as well. And you're looking at genetic changes in the tumor itself. And that is really where it's informing more on therapies going forward. And another big part is that cancer genes are typically dominant genes. I think there's only one that may not be, but it means that runs in the family. These are hereditary cancer genes, so the family may or may not know. A lot of times we don't have 8 siblings anymore, so a family might only have 1 or 2 siblings, and it's a smaller picture to look at than it might have been once upon a time. And then we don't always know our full sides of the family. You might not know all of your aunts, uncles, and cousins, and so it's really hard to get a good picture of the types of cancers that might be passed down in a family. But if we know that a child or any patient is affected with this type of gene, so they have a positive mutation, and we call that either pathogenic or likely pathogenic. If we discover that, we're able to do what's called family variant testing, and Invitae will test every blood family member for that particular gene or mutation for a certain period of time. So it could also help the families as well.
That's awesome. And
Mm-hmm.
I know you already mentioned that Invitae does accept insurance, but it just depends on what insurance that you have. And you already talked
Yeah.
about if their provider won't write them a prescription, that there is a third party that they could go with, so that there are other options if they want a genetic screening. And I'm actually going to backtrack a little bit more, because I know when we were talking about like if a woman's pregnant getting these screenings, but what about if they aren't pregnant yet, but they want to have a baby?
Yes, that's the ideal time to order a carrier screen, in
Okay.
my opinion, because it gives them the most options. So if they decided to, first of all, you're just going to be more planned, right? You're going to be able to plan better. You're going to be more informed. You'll know what to expect potentially. And then there are other options that you might want to be interested in or know about or pursue, like potentially go to see a reproductive endocrinologist, go into the IVF setting, and be able to find the healthy embryos that you would like to carry a pregnancy on going forward. So there are several options that you'd have all of them open to you if you did carrier screening prior to getting pregnant. When you're pregnant, it's also very important and a great time to know. It's just that your options are it's less time to plan, right? There are different strategies and things that you could do next once you are already pregnant.
And if someone does get tested through Invitae and they end up being a carrier or positive for something, how does Invitae support them?
Well, if somebody is a carrier, and I absolutely, Molly's going to be able to talk a lot about this. We have genetic counselors with certain conditions and across certain spectrums that we're testing for, that would be able to walk a patient through what that diagnosis or what those results mean to them. We also work with the provider and walk them through. And we have very nice reports that have clear-cut management guidelines about how to manage your patient care going forward. I'll let Molly kind of go into that a little bit
Yeah,
deeper.
I can echo Catherine's sentiments about our reports are meant to be very educational for both the clinician and for the individual receiving the genetic test. There's a lot of practices that work with genetic counselors within the healthcare system. They may refer internally and have access to prenatal genetic counselors who can talk through what does it mean to be a carrier of a disease and what are variants in your DNA, and then just step by step walk them through having partner tested and what are the chances of having an affected pregnancy and what might that mean. Can educate about the condition itself, the severity of symptoms, what types of symptoms to suspect. But as Catherine mentioned, we know that access to those genetic experts might be limited depending on where someone lives. There may be wait times, there might be a lot of other factors that on top of pursuing pregnancy. And, we're living through a very interesting public health climate too. We have a lot of anxiety and they might have more immediate questions. We also have a team of board certified genetic counselors who they could schedule with online or by calling in, and they might have access to an earlier appointment to go over those results with us. And we can share that consultation, what's been done during that session with their provider.
I should also mention, sorry, Marlene, one more thing is on our website, under that same section where you'd be able to click on Genome Medical, GENOME Medical, which is the third party that can help facilitate these tests. We also have a link that can refer you to a genetic counselor close by or a provider close by. So there may be somebody in your area that you're just not familiar with, and our website is just a fantastic resource to help maneuver there.
How big is Invitae? Like, how many states are you all in?
We're in several countries.
Wow.
Yeah. Oh, yeah. We have Invitae is an incredible lab. We have an international presence, and the mission is just so fantastic. I love that it's crossing boundaries. We want to have everyone who can benefit from it. And in my humble opinion, that's every human, to be able to have access to this type of information. And every doctor should be able to offer it to a patient without worrying about whether or not they're going to be able to pay for it. So you mentioned we're a network with insurance. We are. We cover so many lives. We're a network with a ton of insurance, including Medicaid and Medicare and every PPO and many local HMOs and things like that. Just we have a huge presence. And when and if we don't, we have a very, very patient-friendly price. And the fact that we do that family variant testing for some of our diagnostic tests is really, really helpful, because a patient won't have to incur those costs all over again. We're going to be able to screen all their blood family members and be able to give them information that could literally change their lives.
That's awesome. And this was great information. I want to make sure that we covered everything. Those were the questions that I had listed. I think we covered all my questions. So is there anything that you all want to add that you feel like we didn't get a chance to talk about?
How much more time do we have?
We have a lot of time. Yeah. It's only been 30 minutes.
I think there was maybe one question that I remember getting asked a lot when I'd work with patients who are followed in our multidisciplinary neuromuscular clinic that I previously worked in, where they, were surprised by a lot of their child's diagnoses. Maybe they weren't offered the carrier screening or the extent of carrier screening that might be available. And a really, really common statement was, there's no family history. There's no one else in my family who has this diagnosis. Catherine walked through a pretty complex principle of how do you inherit genetic variation from your mother and your father, and depending on how much that impacts the gene can influence whether or not you have disease. To be a carrier, you're really a silent carrier. It's in your DNA, and without doing a genetic screen, you wouldn't have a family history. It's not until two partners who are carriers of the same condition, they're not even guaranteed to have a child with the condition, but there's a chance. There's that 25% chance for recessive conditions. So you don't see family history for a lot of the conditions we screen for. Maybe the sibling does have symptoms and they were just undiagnosed, and now this new child has more severe presentation, and maybe that's what triggers their diagnosis, and then later a sibling is diagnosed. But it can be, really a diagnostic odyssey for a lot of families, and it's a lot of new information to go over and complex principles. I think I went into genetics, so I love genetics, but AP biology was a long time ago for a lot of us, and writing out Punnett squares and looking through those chances. So I think that's one principle where this could have informative results regardless of your family history in the context of carrier screening.
Definitely. I know I was thinking with my own results, I was like, okay, so both of my parents are carriers and I have 4 siblings and we're lucky that we're all healthy. Because I know then that would mean that we had would it be a 50% chance or a 25% chance?
I need to get a whiteboard out so we can draw this out. That's what I would do. Yeah, if both parents are carriers, so like if these are my 2 copies of a gene, and so if I, have a genetic change that's considered positive, and then I guess I don't have 2 sets of hands, so it's hard to do it with my hands. But
here, I'll lend you mine.
there's a 25% chance for the child to be affected. Actually, 1 in 2 chance for them to be a carrier because they either get it from mom or they get it from dad, and then a 25% chance, or 1 in 4, that they don't have any genetic changes because they get both healthy copies from mom and dad. So it's very complex, and I think there's a lot of educational opportunities, and fortunately I think there's more and more recognition that genetics could have an impact on how you manage your health. And I know, to kind of go back to the audience here of PTs, OTs, and speech language pathologists who work with a lot of these children who have complex medical needs, you guys are phenomenal in that there's lots of research and clinical trials that we're actually using your measurements and exercise tests and other things to kind of see how the natural history of these conditions, or if they get put on a treatment, do they have improvements? And you guys are helping physicians and social workers and genetic counselors and those of us who have a lot of care for these families really get those children to be as successful as they can in their everyday lives. So thank you guys for what you all do, and hopefully and as I'm not trying to wrap up, but as we continue, you'll feel more comfortable talking to your families who may have children with these genetic diagnoses, because I know plans are tailored to the individual, but there are maybe some opportunities that, based on their diagnosis, you have an even more confident approach in how you're going to manage that child moving forward.
Definitely. Thank you so much, Molly. That was said so beautifully. That was really good. And Catherine, did you have anything that you wanted to add, before we?
I think we've covered a lot, and I don't want to overwhelm because it's a lot, right? I mean, just remember things are always changing. And like Molly said, there is a lot of room to educate people, not just the providers who are ordering, but the patients themselves, and you guys who are working directly with patients that could suspect something that might not have even been thought of yet. I think it's just all about awareness and letting everyone know that there are things that you can do. Testing is available, and it is very affordable, and it's very real, and it can literally change lives. I can't underestimate that, at all. It's very powerful. And when someone does find out, there was a story I heard once, and a patient had a child that was affected with a very serious condition, and she said, "It's not. I don't mind knowing that I'm a carrier of this. I don't like how I found out. I would have liked to have been prepared. I would have liked to have had more information and been able to do something about it." So this isn't something that you should be scared of. It should be something that I think should be embraced.
Right.
And the more that we can teach the world about it, I think we'll all just have happy, healthier lives.
Right. And I think it's also important to note, I've had patients in the past that are, newborns and babies, and at the time they don't have any presentation of delays, but they already know that they have a specific diagnosis. So they're getting that early intervention to get in there with therapies to help them progress towards their milestones, before they're actually presenting with symptoms. So I think that's also a great benefit for early intervention and to be able to get screening, while you're pregnant or when you're planning to have a baby. And this information was really helpful, and I hope that it's helped our audience to understand genetic screening a little bit better and to educate their families, that how important it is, and to share the results with their providers, that we're not going to, put a stereotype on their child or put boundaries on their child where, we can get in there early and we're treating them for their abilities and what they can do and what their future milestones are.
Right. And we all want to reach our full potential and have our families do the same and live the healthiest possible lives. And there are things that you can do.
Yeah, definitely. And I want to thank you all so much for your time this evening. I know we're called the coffee hour, pediatric telehealth coffee hour, but it's the evening. So I'd like to know how you all drink your coffee or what your nightcap drink is.
I'm super boring. I just drink black coffee mostly in the mornings.
Good girl. Good girl. I'm a latte drinker. I like coffee with coconut milk and, as creamy and fluffy as possible. And my cocktail, my big girl drink is Tito's and water. I'm simple.
I've been trying to make my palate like black coffee. So I've started just putting a little dab of like almond or coconut milk, to try to get it black.
Yes.
So I know that's supposed to be better for you.
Right. Yeah.
Well, thank you, ladies. And if anybody thinks of something that we didn't cover and you want us to do another coffee hour about something else that you can think of, then let me know. And also, if you have any questions, I'll be putting Catherine's email in the Facebook group under comments. She'll also temporarily be a member in our group if anybody has any questions. And also, what is the website they can go to again, Catherine?
Yes. So Invitae is our website, and it's spelled INVITAE.com. And if any of the other providers out there would like more information on how to have these tests ordered, they can always email clientservices@invitae.com.
Great. Thank you so much. Y'all have a nice evening.
Okay. Thanks, Marlene.
Thank you for having us, Marlene. Bye.
You're welcome. Yeah.